Hey docs, this is Dr. Krista Burns from the American Posture Institute, and I want to welcome you to the 3-video series on head posture analysis and structural restoration. So let's get to it with video number 1. The killer impact of forward head posture. Your community needs you. Forward head posture is a modern-day health epidemic that is robbing your patients of the quality of life that they deserve. With rapid advancements in technology, the postural design of society is diminishing and the biologic sustainability is declining. Did you know that 60 to 90% of the adult population presents with the forward head posture postural distortion pattern? Did you also know that 34% of school-aged children are now presenting with forward head posture? Where are they learning these poor postural habits? Our children, the future of our society, are learning poor postural habits at school and at home. They are sitting in uncomfortable positions with no education of how to sit with proper posture during an 8-hour school day. Then after school, children are spending more than the recommended 2 hours of time in front of a screen, meaning that instead of playing outside, doing homework, or playing sports, average children are sitting in front of a TV, computer, iPad, or phone screen to pass their time. The American Academy of Pediatrics suggests that children ages 3 to 18 should not exceed the healthy limit of screen time per day, which is a maximum of 2 hours. And yet 46% of 3rd graders exceed this limit, and 90% of 9th graders exceed this limit. Have you seen the recent TextNext study that went out showing that as the head flexes forward, as if to check a text message, the weight of the head increases from 10 to 12 pounds at a neutral spinal presentation to 60 pounds at 60 degrees. Text messages and interaction with technology is a massive contributing factor to the high prevalence of forward head posture in our society. Research shows that on average, there's a 10% increase in forward head posture when working with the computer display. According to OSHA, poor posture at work results in 34% of all lost workday injuries and illnesses. As technology is advancing, posture is declining. Posturally weak and sedentary children become chronically ill adults. This is an epidemic, a serious one. Society at large needs to be informed and educated of the ill health effects of sitting in front of a screen with forward head posture. Your community needs a posture expert like you to make a change. Each of you has the ability to and should be specializing in practice. When you define your unique expert position as a posture expert, you become the authority in your community to tackle this serious epidemic. Specializing and narrowing your focus to postural correction opens a world of opportunity to provide 90% of the population who is suffering from these common postural distortion patterns with expert-level care. Now let's get clinical with our conversation. We talk about forward head posture a lot as practitioners. So what exactly is it? Forward head posture is defined by Silva et al. As the protrusion of the head in the sagittal plane so that the head is placed anterior to the trunk. Rain and Twomey suggest that forward head posture is the result of an extended cervical spine, protracted shoulder girdle, and hyperkyphotic thoracic spine. Forward head posture is considered a factor of excessive stress on the cervical spine, often resulting in pain and other symptoms. Postural distortion patterns of the cervical spine initiate structural dysfunction and physiologic disease processes. Balance and symmetry on tissues enables these tissues to respond to stress from gravity and other forces. When symmetrical balance is lost due to abnormal posture, the stresses and strains cannot be overcome and degeneration ensues. Structure dictates function. What exactly happens to the body when forward head posture is present, both from a structural perspective and pathologic correlation? From a musculoskeletal perspective, forward head posture is characterized by different presentations of the spinal curves. The patient may present with loss of the cervical lordosis, which is seen in the research as a cause of degenerative changes in the disc and vertebral bodies due to asymmetric load patterns. Or, the patient may present with an increased lordosis of the cervical spine. This presentation occurs when there's an increased kyphosis of the thoracic spine. As the thoracic spine develops a hyperkyphosis, the compensation of the cervical spine is an increased lordosis. The cervical spine goes into extension as the eyes seek to be parallel with the horizon. What does all of this mean for your patients? Clearly, this information is important for the clinician to make accurate postural rehabilitation recommendations to the patient. but it is also helpful in understanding the forward head posture connection with other disease pathologies. Let's discuss the physiologic compromise of forward head posture as a research review. Each pathology that will be presented has an evidence-based correlation with the forward head posture postural distortion pattern. Many of you have probably heard the research study by Kapanji. For every inch your head moves forward, it gains 10 pounds in weight. This additional weight compromises the tissue of the cervical spine and causes neck pain and stiffness. This forces the suboccipital muscles that raise the chin to remain in constant contraction, putting pressure on the 3 suboccipital nerves. This nerve compression may cause headaches at the base of the skull. In the long term, areas of muscle attachment on cervical vertebra and nearby joints, such as the facet joints, become inflamed and sore. Facet joint pain from pre-existing arthritic degeneration may worsen. After the presentation of neck pain, what do you think is the next most common symptomatic presentation of patients with forward head posture? Headaches, exactly. Research indicates a negative correlation between craniovertebral angle and chronic tension type headache frequency, meaning that the greater amount of forward head posture is related to increased frequency of headaches. I know a lot of you see patients that have neck pain and headaches, but do you also check for temporal mandibular joint dysfunction? TMJ disorders develop when stress is applied to surrounding tissues and they become inflamed and chewing and biting becomes difficult. TMJ disorders can range from a slight irritation to a severely debilitating condition that is affecting 35 million people in the United States at any given time. A well-established premise in the field of cranial, mandibular, and cervical spine orthopedics is that forward head posture adversely affects mandibular position and therefore dental occlusion. TMJ disorder patients typically have both forward head posture and backward lower jawbone posture, where the condyle moves posteriorly. If the head posture causes mechanical strain to the lower jawbone is shifted back and the head is shifted forward, causing dysfunction of the TMJ joint. Have you considered the impact of forward head posture on respiration? Forward head posture may result in the loss of 30% of vital lung capacity. These breath-related effects are primarily due to the loss of the cervical lordosis, which blocks the action of the hyoid muscle, especially the inferior hyoid, responsible for helping lift the first rib during inhalation. Do you also test balance for your patients on their first visit and reevaluations? Research demonstrates a significant disturbance of balance in healthy adults who present with forward head posture. The center of gravity of forward head posture patients tends towards anterior rather than centralized, as with patients who present without forward head posture and proper balance. And carpal tunnel syndrome, the most significant radiculopathy of the upper extremity, is also correlated with forward head posture. Patients with mild to moderate carpal tunnel syndrome exhibited a greater forward head posture and less cervical range of motion as compared to healthy controls. There is an extremely severe increase in pressure to the cervical spine based solely upon changes in posture from neutral to looking down, which the far majority of the population does for 2 to 4 hours per day. Students who carry backpacks that exceed 10% of their body weight are also at risk for forward head posture. Multiple studies have shown that children who wear heavy backpacks have a decreased craniovertebral angle and increased forward head posture. Results of the studies reveal that both backpack weight and time carried influences cervical and shoulder posture. Now imagine what happens if your child is waiting for school to start. As they're standing with their backpack waiting for the school bell, they're leaning further forward with the neck in deflection to check their cell phones. Then when the bell rings, they go and sit in class for the remainder of the day. Typical adolescent habits are causing a massive postural decline in developed countries worldwide. Your society needs you. Each of you is a health hero, and you need to reach out to your communities and educate them. They have no idea that sitting at school or utilizing their computer at work or sending text messages is the cause of many of their health discrepancies. Patients associate postural decline with what? Age, genetics, and bad luck. As posture experts, we know that this is not the case. By specializing in head posture correction, you can pull your patients into the posture paradigm of healthcare and serve 90% of the population in your community at a high level. If you want to learn everything you need to know about analyzing head posture and structural restoration techniques, we've created an advanced course just for you. This course will make you the expert in analyzing posture images for head posture distortion patterns and will provide very specific, evidence-based correction strategies of head posture distortion patterns. Our goal is to fast-track you to success. The best way to grow your practice is to provide superior, predictable clinical results, eliminate the guesswork, and become competent in this correction. As we're feeling quite generous in the Christmas season, we've prepared a special gift just for you. Until Sunday, December 20th, you can get the e-course Head Posture Analysis and Structural Restoration for just $149 instead of the price of $475. Plus, you'll get $500 worth of bonuses, but you must act quickly. This deal ends on Sunday. Make the commitment now to get the course, improve your clinical results, and grow your practice in 2016. What is included in the $500 worth of bonuses? Let's talk about it. Patient handouts with all of the reverse posture exercises on them. The work is done for you. Simply hand the patient the handout with how to complete each of the exercises. And then a head posture analysis form, so you can easily record the findings from each of the posture images, including all of the different posture angles. Plus a cheat sheet. You'll get a cheat sheet of how to perform each of the angles. This will serve as a quick reference to save you time during your analysis, but still keeping you nice and clinically precise. Plus a research resource guide demonstrating the physiologic effects of forward head posture. And a video demonstrating how you can implement all of this into your clinic for under $100. You don't need to spend a fortune to get better clinical results. At API, we've got you covered. This course provides revolutionary concepts that you can complete in just a few hours from the comfort of your own home. Buy it today and start implementing the strategies right away. At the American Posture Institute, we say your success is our priority, which is why we've created this advanced course and $500 worth of bonuses to make your life easy. The success formula is simple. Watch and learn, implement, see your clinical results improve, and watch your practice grow. API's advanced courses are reserved for the serious docs who want to get better results. We know you have what it takes. We look forward to working with you in the head posture analysis and structural restoration course. And as always, docs, remember, it's posture by design, not by circumstance.